How do you deal with patients with impaired renal function? What about patients on dialysis?
Impaired renal function. So this is not uncommon for us. We have many patients who have impaired renal function, either chronic renal disease, chronic kidney disease, or end-stage renal disease who are on dialysis. This is not uncommon at all. Why is that? Because the pathophysiology and the development of kidney disease and PAD largely are related to the same risk factors. Processed foods, processed sugars, processed carbohydrates, diabetes, smoking, cholesterol, triglycerides. It's the same risk factors. So it's not unusual for us to have impaired renal function. In fact, it's very common. So we're very well-versed on treating patients for PAD with impaired renal function. Now, why is this important? Well, as you know, our procedure is quite safe and innocuous, but we do inject contrast into the arteries for us to be able to see the arteries so we can revascularize them. That contrast is iodinated contrast, as you know, and that theoretically has some stress on the kidneys. True. Now, in a healthy patient, otherwise healthy with no renal function, impaired renal function, no problem. We don't use too much contrast and the kidneys will flush it out. However, if a patient has impaired renal function, which is something we assess during our evaluation, okay, in our pre-procedure labs, GFR, etc., then we have multiple tools in our armamentarium to deal with that, okay? Off the top of my head, we'll ask the patient to hydrate a little bit more prior to the procedure, okay? We'll ask the patient to hydrate, drink more water after the procedure to help flush the kidneys out, okay? We'll ask the patient to withhold certain medications that are a little bit tough on the kidneys a couple days prior to the procedure, namely metformin. We might ask the patient to take Mucomist, which is a renal protective medication, okay? We'll also can use low-dose contrast. We can use diluted contrast, so the stress on the kidneys is even lower. Sometimes we can use no contrast, and instead we can use CO2. We do a CO2 angiogram, which isn't nephrotoxic at all. And finally, we use IVUS, intravascular ultrasound, allows us to be able to see the plaque and treat it using far less iodinated contrast. So, impaired renal function is not uncommon with us. I've had patients, referring physicians call me and say, oh, well, my patient has chronic kidney disease. Surely they must have to go to the hospital or get a nephrologist clearance or something like that. Not necessarily. Go ahead and send them to us. We do this all the time. We see patients with impaired renal function all the time. During our 7-point evaluation, which is the first visit, right? History and physical, photographs of the legs, ankle, and feet, walking impairment questionnaire, handheld Doppler, pedal pulses, ABI, duplex arterial ultrasound. We also inquire about the renal function, we check their labs, and if they have impaired renal function, we know what to do to prep them and protect their kidneys for the procedure. Dialysis, the next part of the question, what about patients on dialysis? Well, unfortunately, dialysis means the patient's kidneys don't work at all. And basically, they have to go to dialysis every other day, so the dialysis machine can do the job of the kidneys, filtering out the blood. Okay, so that's no problem. We can certainly treat those patients, use contrast on their arteries to help revasculate, so we can revascularize them. We time our procedure to where the procedure will be the day before dialysis. So the next day, the patient will go to dialysis and the blood will be filtered and the contrast will be washed out of the blood.